at work trying to confuse the population, spread misinformation, and mischief. Yesterday, a decision was taken to put out a new regulation which allows for the opening of hardwares, electrical businesses, and plumbing businesses on a Monday, a Thursday, and a Saturday from 8 a.m. to 12 noon. These three types of businesses, hardwares, electrical stores, and plumbing supply stores, will be allowed to open on a Monday, Thursday, and Friday. Monday, Thursday, and Saturday from 8 to 12. Some on social media hijacked again the Ministry of Health's letterhead, and then, in an effort to cause panic, included pharmacies and groceries. Let me state categorically, it does not apply to pharmacies and groceries. Citizens of Trinidad and Tobago will have access to the full gamut of medical care, including pharmacies, will have full access to food, including supermarkets, throughout. There is no closure order for pharmacies and supermarkets, and I urge the population to ignore that social media post. Ladies and gentlemen, in dealing with the COVID-19 pandemic, it is important for us to revisit some data and some graphs, which I will now ask to be put up as I walk you through what this graph means. It is a graph on the left-hand side in blue, the total number of cases in the world, and on the right in orange, the total number of deaths. We have been saying, do not misinterpret our data to mean that we are in the clear. If you look at total cases in blue on the left-hand side, starting from January 27th, I believe it is, you would see a slow, steady increase in total number of cases from January 22nd. That more or less mirrors where we are. Slow, steady incline, which we can cope with easily. However, from around March the 7th to the 16th, what you started to see was this slow incline, which we could walk easily without losing breath, suddenly turned into an almost vertical wall where no one can climb. Total number of cases. That is what is called exponential growth, as opposed to the linear, slow growth from January 22nd to March 7th. We are in the first stage there. We are trying to avoid reaching that wall of cases that when you look up, it reaches to the sky. Mirroring that on the right-hand side is the orange graph, which talks about total deaths. Total deaths started with the same slow incline from January 22nd, but it mirrored the total cases with a lag time of about 4 days to a week. So from March 16th to March 25th, what you started to see was this wall of deaths around the world. Ladies and gentlemen, we have had to date 8 deaths. The measures the government is applying to the society is not to punish anyone. It is to save lives. We do not want our graph to look anything like this. That is the objective. On Saturday, I would have alluded to the fact that one of the countries in the world which was considered the gold standard in how to manage COVID has now regressed. There's another country, and again, I wouldn't call the country's name, it is not to shame any country, but we could learn, that is now talking about their healthcare system collapsing. And let me explain why that is so important. One of the measures that we use to determine how robust a healthcare system is the bed to population ratio. This particular country has one of the highest bed to population ratios in the world. They have 11 beds to every 1,000 people in population, 11 to 1,000. Their second wave is now threatening to bring down that system. By comparison, Trinidad and Tobago has about 3.3 beds per 1,000. We have less than 1/3, and we are nowhere near to collapse